I wanted to thank everybody for coming. My name's Matt Cave, and I'm the host of the symposium. So I really wanted to thank our sponsors. This is an NIEHS sponsored symposium. We were able to obtain sponsorship from several additional sources as well listed here. So I'd like to thank all the sponsors for this, and just had a great time last night. I had the chance to meet a few of you all at dinner and catch up, and I'm just so excited that everybody could come. And the level of excitement that I saw last night was just huge. And you know, when I tried to put this together and started out, the response that I got was just incredible from everybody. You know, when I sent out the emails, would you be willing to come? And you know, some of you didn't even know me, and you know, the level of participation and excitement was just huge. So thank you. But you know, in fairly short order, we were able to put together what I think is a tremendous program, and in my mind, better than AASLD, better than SOT, because it's very focused on liver and toxicology. So we have 76 registered participants right now. I think we're going to have over 100 total, because we expect some people from the university that probably haven't registered would stop by. So hopefully everybody got a wristband, and so people with the wristband were kind of have already registered, and so we've got room to accommodate those people here. For some of the walk-ins, they may be directed to a room across the hall where everything is being broadcast. Also, the wristbands are important for lunch, so we tried to get lunch for everybody here, and then if we have people dropping in for lunch, we might run out. So that's the other purpose of the wristband, is just identified who's registered. But at any rate, we have 76 participants, and we have representatives from 4 countries, including the United States, also France and Sweden and Egypt, and there may be some others that I didn't count. We have people from 16 states. We have approximately 20 abstracts that are going to be presented, and here's a list of all the institutions. I didn't count them all, but as you can see, there's many there. So I had a question last night during dinner: who is Carlo Tamburo, and why is this the Tamburo Liver Symposium? So Carlo Tamburo was a hepatologist, and he was an expert in occupational hepatocarcinogenesis. And the symposium is held in his honor. So he worked at the University of Louisville from 1974 until his death in 1999, where he was the GI chief. And most notably, he was director of the vinyl chloride research project. And so what happened was, in Louisville in the early 1970s, a cluster of hemangiosarcoma of the liver were identified at a local B.F. Goodrich plant, and really became a sentinel event in occupational health in general. And Carlo was brought down from New York to institute a surveillance and screening project. And his legacy, really, for me anyway, was that he created this very large specimen bank, the U of L Liver Research Center and Occupational Toxicology / Medical Surveillance Biorepository. And so we've got well over 20,000 samples from over 7,000 unique chemical workers, serial blood samples. And Carlo, and I feel his pain a little bit, being somewhat short-staffed as a clinical hepatologist, but Carlo was the only hepatologist in town, and so he was so clinically busy. Although he had 47 publications, mostly on this vinyl project, he really didn't get to make good use of this biorepository, and so that was kind of handed down to Dr. McLean and I, largely intact. And so we're trying to make use of that, and that's how I got interested in liver disease. Through him. So I'd just like to recognize his accomplishments and his legacy of this large biorepository. And one of the purposes of this symposium is to foster collaborations. And so, you know, we'd like to make that available if anyone has any good ideas on how to use that. And we'll talk more about that resource over the next 2 days. So several objectives. We want to define mechanisms of liver injury, fibrosis, and metabolism. That's the early session today. I think it's becoming increasingly important that nutritional co-exposures, such as high-fat diet or ethanol, modify the liver response to xenobiotics and environmental chemicals. So I think that will be important, and that'll be covered over the next 2 days. And then kind of later today and into tomorrow, we'd like to review specific chemicals and what they do to the liver, both cancer and non-cancerous lesions. And moving forward, a major issue we've had is with poor biomarkers for liver disease, at least in the human populations. And so I think it's going to become important to examine new technologies to facilitate liver toxicity screening, such as ToxCast and Tox21 efforts, and then looking for biomarkers of liver disease, and there's a session tomorrow on that. So here's our 7 sessions: mechanisms of liver injury, fibrosis, xenobiotic metabolism, pharmacogenomics and adaptation, halogenated aliphatics, and metals/metalloids to fit in arsenic, I guess, in parentheses, PAHs, chemical hepatocarcinogenesis, alternative strategy, system biology, and biomarkers. And then the final session would be kind of a wrap-up. One thing I'd like to do and hope that comes out of this would be some type of symposium summary proceedings for a manuscript. If anyone has any connections to any journals that might be interested in publishing such a manuscript, please let me know. And if anyone's interested on working with me on that, let me know. So these, the schedule is, so it's listed here in the brochure, and so we're trying to cram a lot in over the next 2 days, and so we have half-an-hour talks and try to keep them to 25 minutes, 20 to 25 minutes with questions and answers. And the reason so many things are crammed in is because when I sent out the invitations, I really didn't expect more than a 50% response rate from people, but it was nearly 100%. And so I couldn't come back and say, well, you know, Dr. Ramos, we're not going to include you because we're too full. So please try to be respectful of time so we can stay on schedule. You'll notice that there are some moderators too, and so what I tried to do was put a speaker or two on each session to come up and set up here as a moderator. In case the moderators don't know the speakers too well, for introduction's sake, I've left a paper up here that's got a brief blurb on just about everybody, and I'm welcome to fill in too. So today we're going to cover mechanisms of liver injury, fibrosis. Then there'll be a break and poster session. So all the talks for the first session are loaded. If you're speaking in the second session, please bring your talk up and give them to Steve Mahanes in the pink shirt to load up during the break. And then we'll have the second session on metabolism, pharmacogenomics, and adaptation. So the thought is that in the first session would be more of an overview. There'll probably be a little bit more clinical stuff here too, and the purpose was to kind of orientate toxicologists who may not be quite as familiar with liver to liver. And then the second session is meant to orientate some people that are liver specialists but maybe not toxicologists to toxicology, and try to bring these two worlds together. I think people in this room are familiar with both of those aspects, but we may have other attendees that aren't. So after the second session, we'll have a lunch break and poster session judging from 1 to 2:30. And there's also a breakout lecture if people would like to attend that on some ethical, legal, and social issues surrounding environmental health. And then session 3 will kind of starting in specific agents that cause liver disease. And that'll go till about 5. And tomorrow we'll continue some more of these talks on selected agents and cancer and alternative testing strategies, and wrap up. So we are being recorded, and there will be a link that's generated, and the link will be posted on our conference website, which is liversymposium.org. And so you can review talks at your leisure later on, or if people that you know that might be interested couldn't make it, you can share the link with them. And so Thad, I've already told Jerry Heindel about this, so we'll make sure we share this with Jerry. And then we've also have some memory sticks, and we intend to pass those out to people too with the talks on them tomorrow. So I'm going to try to give just an overview of chemical hepatotoxicity, in my last couple minutes, and why I'm interested in this. And so there's over 88 million chemicals now registered with Chemical Abstract Service. Every time I give one of these talks, I go to CAS, and there's always about 5 to 10 million new chemicals. Even just over a matter of months, there's millions that are added. And so there's no way we can understand the toxicity of all these chemicals. Now, we don't know how many of them affect liver, but of the 1/3 of the 677 chemicals published in the NIOSH Pocket Guide, hepatotoxicity is documented in 1/3 of these most commonly used workplace chemicals. And the liver appears to be the most common target organ for chemical toxicity, and that's probably due to its role in xenobiotic metabolism. Over here are EPA data for non-cancerous endpoints and various organs here, and you can see that liver was number 1 in these assays, and over 25% of the chemicals affected liver. So what do chemicals do to liver? What are the pathologic lesions? This is just a list of, here you'll see different types of liver pathologies and some examples of certain chemicals that can cause them. This isn't a comprehensive list, but it's just meant to illustrate the idea that chemicals can cause many, many different types of liver injury. All right, and so what about priority chemicals? So this is the top 10 substance priority list chemicals from ATSDR, and as it turns out, essentially all of them, with the possible exception of number 10 that I know of, have been implicated in liver disease. And the ones in red are actually going to be covered over the next 2 days in specific talks. So I think we'll get we're dealing with important chemicals here, and I think at the conclusion of the symposium, hopefully we'll have a handle of it. Now, Kentucky is rich in these chemicals. This was Valley of the Drums, which was one of the early Superfund sites. And in fact, that Valley of the Drums, along with Love Canal, are some of the reasons that we have Superfund sites. And so this was basically a dump, 40 minutes away in Brooks, Kentucky, that was contaminated with a lot of PCBs, but many other chemicals, including metals as well. And we've recently been dealing with this brownfield site called Blackleaf here in Louisville that has very high levels of arsenic, pesticides, and other chemicals. And that's just a heat map showing red arsenic hotspots at this site. So we're unfortunately rich in many of these. All right, so what about epidemiology of liver disease? How important is liver disease? So in 2011, there were 56,000 deaths in the U.S. attributed to cirrhosis and liver cancer, and that's basically as many as heart failure. So liver disease is not only common, it's growing. So cirrhosis was the number 12 cause of death, and that increased over 2010 by 3.2%. So this epidemic is big and it's growing. Hepatocellular carcinoma is the fastest growing solid organ tumor by incidence. Many tumors are going down in incidence. Hepatocellular carcinoma is rising. Chemicals may be playing a role in this. NASH prevalence is 34% in adults and 11%, nearly 11% in adolescents, as per Dr. Voss. And systemic disease. So liver disease not only causes cirrhosis and liver-related deaths and liver cancer, it also is a major driver of cardiovascular disease and mortality. And here's an example of liver disease. This is for hepatitis C, and so there aren't a lot of data on the effects of chemicals and viral hepatitis, but there are some published from Asia in vinyl workers that have hepatitis B and potentially aflatoxin exposures showing synergy for both fibrosis and hepatocellular carcinoma risk. But that's a data gap, is viral hepatitis and chemical interactions. But hepatitis C in the U.S. is a growing problem, and this slide is meant to illustrate that. And so these are projections for the numbers of decompensated cirrhotic patients we're going to see, and that's not expected to peak until 2020. And along with that, the hepatocellular carcinomas are expected to rise. And so what are the effects of environmental chemicals on hepatitis C and these projections? I'm not sure, but Swati Barve and our group has illustrated or demonstrated that certain environmental chemicals such as acrolein and other aldehydes may impact the response to therapy and decrease efficacy of antiviral medications for hepatitis C. We have Rubbertown here in Louisville, and this was the site of the hemangiosarcomas, and I'll talk to you more about that. And importantly, it's associated with Lee's Lane Superfund site, which, along with Valley of the Drums, was one of the very first Superfund sites in the United States. So it was a chemical manufacturing complex. They dumped all their waste in a landfill near the river. And some of the lesions that we've seen in Rubbertown that have been made possible through our specimen bank are hemangiosarcoma, and more recently we described toxicant-associated steatohepatitis, or TASH, which had an 84% prevalence in highly exposed workers. Their liver biopsies looked like alcoholics or obese people, but they didn't drink and they weren't obese. And steatosis was present in 84% of them, and steatohepatitis in 80%. So the sample size was relatively small. It was only 25 subjects, but to my knowledge, and this is the highest reported prevalence of steatohepatitis in any population ever reported, even though it is small. So bariatric surgery patients have about a 90% incidence of fatty liver, but not that many of them have inflammation and fibrosis. And so we believe that certainly high-level chemical exposures can produce significant liver disease. Now I talked a little bit about cofactors, so we've got them all in Kentucky. We've got alcohol, we've got KFC, and we've got chemicals. So this is a unique environment to study some of these factors in. I'll skip that one in the interest of time. We have a manuscript that's recently been accepted for ToxPath, and it's difficult to study environmental liver disease because we don't know what chemicals cause it, and so the biomarkers are very poor, and I'll demonstrate that as we go along in some other talks, but we tried to generate a list of chemicals that cause fatty liver using archived pathology studies from EPA and NTP, ToxRef, and SEBS, and so we were able to search electronically for chemicals that were associated with pathologic descriptors in rodent studies. And so what we found is that there were 123 unique chemicals that had caused fatty liver out of 371 studies, so some of them were positive in multiple studies. And interesting to me anyway is that most of these chemicals were actually pesticides. And of the pesticides, they were primarily fungicides and herbicides rather than insecticides, which was a little bit surprising. And importantly, in all the pesticide registration studies that were reported in ToxRef, about 10% of them were associated with fatty liver. Now, I don't know if the doses that cause fatty liver are relevant, and I don't know if the pesticides themselves are relevant. I don't know which ones of these are being used, but it's certainly concerning that 10% of them at least caused it. And even more concerning was that there were 10 multi-generational reproductive pesticide studies where fatty liver was found in the offspring of mothers that were exposed. And Dr. Voss will talk to us about pediatric liver disease and could maternal exposures play a role. I think these are some early data showing that they potentially could. So in Conclusion, liver is the most susceptible target organ to chemicals. Chronic liver disease and liver cancer is truly an epidemic that's worsening. It appears to be driving, at least for the clinicians, it's being driven by hepatitis C and NASH. But I think that there are chemical interactions that are going to be interacting with viral hepatitis, alcoholic liver disease, and diet-induced obesity that are going to compound this problem. And hopefully we will learn more about that over the next 2 days. Biomarkers are an issue in our biorepository studies of liver cancer and steatohepatitis. The traditional chemical biomarkers, AST and ALT, are perfectly normal, and it actually, in some cases, they appear to be nearly significantly lower than control populations. And so I think we're not even seeing the tip of the iceberg. So even when we're screening for liver disease in at-risk populations, we're missing it because the biomarkers just are not very good. And so that is really a focus of our group, trying to develop more effective biomarkers. And again, alternative high-throughput strategies are going to be important to screen all of these many new chemicals to determine which ones of them are going to contribute to liver disease. So just wanted to thank again our sponsors, speakers. We've had some help with advertising through various societies, and then we've got several people such as Lark Reynolds, who I believe has been in contact with most of you. Hopefully you get a chance to meet her. Steve Mahanes is helping load the slides up, and many others. And I guess I'll just conclude there. Any quick questions or comments, concerns before we move into the next session? No? Okay. So I guess if we can go ahead and start with session one then, and I've got Craig and McLean and Bob Roth here as moderators. That's okay, and then we'll start off actually with Dr. McLean on nutrition and gut-liver axis.